Mental health care is a necessity, not a luxury. Everyone in this world, in all these communities, are deserving to having access to a reliable mental health care facility and provider. Today I'm going to be discussing why rural communities are so much deserving, just as any other community in the world, of having access to a mental health care provider. I'm going to be going over some barriers today that many people face when trying to locate a provider for their mental health care needs and some solutions. Starting off with insurance. Insurance is a wide known barrier for many people and a very wide struggle. Some providers only take specific insurances, and many people's works may not have that cost for a mental health care provider, or they have a limited budget to pay out of pocket. Medicaid is a very wide known insurance company, and many people rely on that, and some providers may not take that, for example. Many people suffer from long wait times, so that would be 2 to 3 to 4 to 5 months of waiting for an initial appointment with a provider, and that can be crucial for some people with mental health disorders. Long drive times. People have to drive an hour to 2 hours out of town for a provider because their community either had long wait times, or they had no appointments or no clinic or provider reliable to them. Some people may not have any transportation or no family friend that can help them get to an appointment. Some people may have no child care. Maybe some people do not have the affordability to put their children in a daycare, or their child was sick and they could not bring them with them to the appointment, or just overall just don't have that accessibility to them. There is a worldwide shortage in providers such as psychiatrists, psychologists, and it's a very competitive field, and just not enough providers in certain locations that there should be. And some communities don't even have a mental health care clinic accessible to the people in that community. Some things that we could do as a community to help strengthen ourselves and our people is starting off with teaching and integrating counselors into schools, and helping these teachers and counselors look for signs in these children with behavioral issues that can help an early intervention for the children for their future, and that can help relieve stress off the parents for having to do long drive times or long wait times with other clinics, and it's not costly to the family with having a counselor in the school, and that can help the children feel safe in their community and their school with being open with these counselors and teachers about how they feel. Next is telehealth. Telehealth is a really great thing for people that need to have an appointment at home, and this is where they can talk to a therapist online about their mental health needs, and it's very very great. Well, some areas do not have the broad range for internet in their areas, and this would help with the city funding that and making sure that all of these areas have access to reliable internet so they can have a telehealth appointment with the therapist. That would relieve the long drive times and the long wait times, and it would give them a safe space to talk to that therapist about what they need and what's going on in their lives. Funding from cities is a big one. We really could help with funding into local clinics with our primary care providers, and you already have your providers, so you're already comfortable with them, you know them, they know you, and then integrating a mental health care provider to get to know if you need that mental health care, and that would shorten the drive time again and the long wait times, and it would just make you feel safe and comfortable in that facility already, and you don't have to go outside of your primary care and look for another clinic. Prioritizing mental health. I think a lot of communities can prioritize this by supporting mental health campaigns or surveys, or checking on your friends and family, your children, just being a very wholesome and loving community, and trying to drop that stigma of looking for help makes you weaker, when in general it just makes you stronger. People with substance abuse, having rehabs in our communities that have mental health counselors. Maybe those people suffered from a mental health disorder and were not able to seek out for help. They turn to substance abuse to numb those feelings, and they need that mental health care. Many people suffer from anxiety, depression, postpartum depression, suicidal ideations, and even ADHD is a behavioral issue, and many people need help for that. going into ERs where they don't have the proper help for those people that need that mental health care, and just integrating actual mental health care providers there and having the clinics for these people can really help and build our community stronger. So, supporting campaigns, having those heart to heart conversations, help increase funding, talk to your city councils, talk to your mayor, just make sure our voices are heard. It's going to really help overall just make our communities stronger, our children stronger, our schools stronger. These rural communities, we are deserving. Doesn't matter what zip code we have, we are deserving of mental health care. Thank you.